Medicare just received one of its biggest changes in years with the recent passage of the Inflation Reduction Act of 2022, which was just signed into law. We will give you an overview of what to expect from this new legislation and what it might mean for your Medicare coverage going forward. My name is Cameron Giardini, and I help operate Giardini Medicare, which is an independent Medicare-focused insurance agency based in Michigan. Just a quick disclaimer for this video. This is an overview of the changes implemented by the Inflation Reduction Act as we currently understand them, and we will link to all of our sources down below in the description of this video. Many of the details in this video were sourced from the Kaiser Family Foundation, which is a nonprofit that focuses on national health issues. In addition to this video, we will put up more updates and details as they are released. So, what impacts might the Inflation Reduction Act have on Medicare? First, one of the biggest impacts, in our opinion, is the fact that starting in 2025, there will be a $2,000 yearly cap on out-of-pocket spending for Part D prescriptions, which also applies to prescriptions provided by Medicare Advantage plans and their drug coverage. However, this does not include monthly Part D premiums that you pay to the insurance company. So in 2025, all of these payments that you make for covered medications towards your deductible, your copays, your coinsurance, those will be limited to $2,000 for the year. To understand how many people this might impact, according to the Kaiser Family Foundation, in 2020 alone, there were 1.4 million Medicare enrollees without low-income subsidy that spent $2,000 or more on out-of-pocket prescription costs. That number is likely higher now due to increases in prescription spending over the last few years. Also, not only is there a $2,000 cap on prescription out-of-pocket cost, but Medicare beneficiaries will also be able to choose to pay for prescription copays and out-of-pocket costs through more affordable monthly payments that will be spread out over the year. This will hopefully soften the financial burden for those with more expensive medications who currently face large bills at the beginning of the year for their medications. With the passage of this legislation, many Medicare consumers are disappointed to see that the cap on prescription medications of $2,000 does not take effect until 2025. However, there is another detail that is often being overlooked that we'll talk about now. So even before 2025, in 2024, the cost for Medicare consumers' medications in the final catastrophic phase of Part D coverage, the out-of-pocket spending will decrease from 5% down to $0 for the remainder of the calendar year. So although the cap of $2,000 does not apply until 2025, there is still going to be a cap on prescription out-of-pocket costs beginning in 2024 because of these changes. And according to the Kaiser Family Foundation, in 2024, if a Medicare beneficiary spends about $3,250 out of their pocket for prescription drug plans, they will reach the catastrophic phase of coverage we just talked about, and their medication out-of-pocket costs for the rest of the year would therefore be reduced to $0. Compare that to this year and next year, when the same Medicare beneficiary would continue to spend 5% of their medication costs for the remainder of the calendar year. I know it sounds crazy, but 2024 is slightly just over 1 year away at this point. As for how many people this may impact, according to Q1Medicare.com, roughly 1.5 million Medicare beneficiaries without low-income subsidies reach the catastrophic phase of Part D coverage during the year. Another cap on prescription medications created by this bill is on insulin. So starting in 2023, all Medicare-covered insulins will be capped at $35 for a 1-month supply, which applies to insulin covered by Part D and Medicare Advantage prescription coverage, as well as insulin covered by Part B of Medicare that is administered via an insulin pump. We hope this will help many Medicare beneficiaries that we have seen struggle with insulin costs throughout the years. Real quick, before moving to the next change from this bill, please leave us a comment below for what impact you think this new law will have and what changes you think Medicare should implement in the future. Now that you've done that, there is another change created by this bill that you may have seen headlines for, and that is the fact that Medicare will begin negotiating the price of some of the most expensive prescription medications. Unfortunately, this provision has one of the latest start dates of the changes made by this bill, but we'll talk about that next. So again, according to the Kaiser Family Foundation, Medicare will begin negotiating the price for the 10 most expensive Part D covered prescriptions beginning in 2023. However, these negotiated prices won't actually take effect until 2026. Then in 2027, this will increase to 15 additional Part D covered medications being negotiated. Then in 2028, instead of only negotiating Part D prescriptions, Medicare will begin negotiating the price of 15 Part D and Part B covered medications. And then finally, in 2029, they will be able to negotiate an additional 20 of the most expensive Part D and Part B medications. It's important to note that each of these years' negotiated medications will actually add to the previous year. So this means by 2029, Medicare will be negotiating the price of the total of 60 of the most expensive medications. However, there are some medications that will be excluded from negotiations, which includes small biotech drugs as well as orphan drugs that are designed to only treat one rare disease or condition. Also, medications that are newly released to the market can't be negotiated by this bill for at least several years. If you are wondering what medications are covered by Part B versus Part D, just remember Part D medications are usually the ones that you fill at the retail pharmacy versus Part B medications that are typically administered at a doctor's office or hospital outpatient facility. Another change from this bill has to do with Part D vaccines. Beginning next year in 2023, there will be no out-of-pocket cost for consumers when getting Part D covered vaccines that are recommended by the CDC Advisory Committee on Immunization Practices. Try saying that twice. According to the Kaiser Family Foundation, in 2020, 4.1 million Medicare beneficiaries received a Part D covered vaccine, with 3.6 million of those being the shingles vaccine. Many of the people we help with their transition to Medicare are shocked to realize that the Part D vaccines, especially the shingles vaccine, can cost a few $100s out of pocket. So at Giardini Medicare, we are glad to see this has been addressed with the Inflation Reduction Act passage. This next change impacts those with low income and asset levels that may qualify for the federal low income subsidy, which is also known as Extra Help. This provides financial assistance for Part D prescription coverage, and beginning in 2024, the upper income limit to qualify for full Extra Help will be increased from 135% of the federal poverty limit up to 150% of the federal poverty limit. Currently, individuals in the 135% to 150% range, they only qualify for partial Extra Help. And this is not a small detail, since currently Social Security estimates that qualifying for Extra Help represents an average of $5,100 of savings per year for those that qualify. At this point, we only have a couple more changes to highlight, so make sure you like this video and subscribe so YouTube knows to show this to more people wondering about how this bill might impact their Medicare coverage. Thanks for doing that. The next change we will talk about is the fact that there will be a cap placed on Part D prescription plan premiums from one year to the next. So we already mentioned briefly earlier in this video that the $2,000 cap on Part D out-of-pocket cost does not apply to your plan premiums, which is basically the amount you pay to the insurance company every month to have your coverage. So this part of the bill is designed to hopefully keep those plan premiums in check. Beginning in 2024 and going through 2029, the base monthly premium for Part D coverage will be capped at no more than a 6% increase from one year to the next. Remember, Part D plans are those that you purchase from private insurance companies that contract with Medicare. All right, so last but not least, let's talk about the fact that the Inflation Reduction Act also includes provisions so that prescription drug manufacturers for Part B and or Part D medications that increase the price of those medications higher than the rate of inflation would have to pay rebates back to Medicare. This change would be implemented starting in 2023 and would use 2021 as the benchmark for prices compared to inflation, which of course this is designed to hopefully keep the cost of all prescriptions across the board down lower. So as you can tell, there have been some major changes to the Medicare program due to the passage of the Inflation Reduction Act. For many of these changes, it will take years before we see the full impacts. You can see an overview of the timeline of these changes on the screen, but don't forget to look at our sources in the description below this video for more information on the full Inflation Reduction Act. Also, we will make sure to keep you updated on all things Medicare in the future. Thank you very much for watching. Make sure you share this video with others who may be curious as to what's happening.